All right, here we are going to start our conversation about the spinal cord. However, before we do that, we do need to cover a couple of structures that encase both the brain and the spinal cord. So, both the brain and the spinal cord are covered by a three-layered membrane known as the meninges. You may have heard of it before with diseases like meningitis, which affects the meningeal membrane. This three-layered membrane can be found encasing both the brain and the spinal cord in one continuous membrane. There is no break in it at all. Nothing allow it anything out and nothing allowing anything in. It is also going to allow for circulation of a fluid called CSF between both the brain and the spinal cord. So the first layer of the meninges is referred to as the dura mater. And matter means mother in Latin. Dura, think tough, durable. So this is a very tough, fibrous connective tissue membrane. It's white in appearance, and it has a ton of blood vessels. If you get the chance to do a gross anatomy dissection where you are cutting through the meninges to get to the brain or spinal cord, you are going to need a very sharp scalpel, and you will need to apply pressure. It is extraordinarily tough. It stands up to its name. And it is just that. It is a protective covering. It does have a lot of blood vessels, and this is going to allow for these blood vessels to pass into or out of the brain and spinal cord. The next layer is referred to as the arachnoid matter, and the reason it's referred to this is because when you look at it, it looks very cobwebby. It's a very thin web-like membrane. There aren't a lot of blood vessels found at this layer, and between it and the innermost layer is something called the subarachnoid space. In this space, and by space, it's not a huge space, it's a very, very small space, we are going to find a clear watery fluid called cerebral spinal fluid, or more frequently, its abbreviation CSF. We'll talk more about CSF in just a few minutes. The innermost layer of the meninges is referred to as the pia mater, and the pia mater gets its name because it is very, very thin, very, very delicate, and it literally hugs the brain and spinal cord. If you're cutting into the brain and spinal cord, you probably are cutting through the pia mater without realizing you're doing so. It has a shiny, almost glistening appearance to it. It's very thin. It looks more like a film than anything else. So it took us a while to figure out it was there, needless to say. But it's very, very thin, and it hugs the brain and spinal cord. So, CSF, what is it? CSF is going to be secreted by those epidermal cells that we mentioned when we were talking about the glial cells. They're specifically going to, or it is specifically going to be secreted by the epidermal cells found in the choroid plexus, but it's going to secrete this fluid, and this fluid will circulate through the ventricles into the subarachnoid space, around the spinal cord and back to the brain, and so on and so forth for about 8 hours. And then it will get reabsorbed by arachnoid villi. What are arachnoid villi? Arachnoid villi are little finger-like protrusions of the arachnoid matter into a space above it between the dura and arachnoid matter. And these arachnoid villi are going to reabsorb the CSF after about 8 hours. What does CSF do? CSF's primary function is to cushion the brain. So when you come to a sudden stop, your brain doesn't smash into the front of your skull, partially because of ligaments connecting it to the brain or to the skull, but also because there's this fluid to cushion it. The other thing, though, it does, and this is just as important, is it helps maintain a stable interstitial fluid environment. What does that mean? It makes sure that there is enough sodium, chloride, and potassium floating around the nerves so that they can send their signals. One of the things we'll talk about in physiology is how these signals are sent, but for now, be aware that these signals are dependent upon a transfer of sodium, potassium, and chloride between the cell and the fluid outside. So if we don't have enough of one of those three ions, we're not going to be able to send signals. So this CSF is going to help maintain that concentration. We actually create about 400 to 500 milliliters of CSF every single day. That being said, there's only enough space in the meninges for about 125 to 150 milliliters of that to be circulating at any given time. This means your CSF is recycled every 8 hours, approximately 3 times a day. Why is that important? If I'm doing a spinal tap or lumbar puncture, I'm drawing off some of that cerebral spinal fluid. And if I test that fluid and I find that the presence of the bacteria that causes meningitis, I'm spacing its name right now, then I know that this is a relatively new infection. It has been present in the past 8 hours. If I take a tap and I have a sample of CSF and it doesn't have it, but my patient then develops symptoms 24 hours later, it's not that we did an incorrect assessment, it's that there were no bacteria there. Sometime in the past 24 hours, they arrived in the cerebral spinal fluid. So it's a very accurate measurement. It allows us to really hone in and be able to say, this is the time frame of these things happening. It was present here, but it wasn't present here. Very, very accurate. And this is different from many other fluids in the body because they're not timed like this. Take blood, for instance. Blood circulates through the entire body over and over and over again. The red blood cells themselves can be up to 120 days old. So if I have some red blood cells that are very, very large, but then most of them are completely normal sized, this could be a new issue causing the enlarged red blood cells, or it could be an old issue. These red blood cells just haven't been removed. They're not done their 120 days yet. So this is one of the rare instances where we can get very accurate time shots of what's going on. All right, moving from there, let's actually get into the spinal cord. So the spinal cord runs down your back. It runs along, or inside, I should say, the vertebral column. The vertebral column, as we mentioned with the skeletal system, is a series of vertebrae that are designed to protect the spinal cord. The spinal cord is divided into sections, and off of these sections, you will have 31 pairs of spinal cord nerves. Why do we say pairs? Because you're going to have one off to the right and one off to the left. So it actually ends up with a total of 62 nerves, but it's 31 pairs. They're going to be named for the vertebral level that they emerge from. Now, this is where things do get interesting. I'm going to scroll down here real quick. If you look at this, you are going to have 8 cervical spinal nerves, but you only have 7 cervical vertebrae. Why is that? The first spinal nerve actually comes off above these vertebrae. C2 comes off below the first vertebrae. C3 off below the second, and so on down the line until we get to the first thoracic vertebrae. Once we hit the first thoracic vertebrae, the nerve is named after the vertebrae above it. So the first thoracic nerve comes out below the first thoracic vertebrae. And so we only have 12 of them, 5 lumbars because we have 5 vertebrae, 5 sacral nerves because there are 5 fused vertebral bones, and then you have your lone coccyx down here, kind of attaching at the bottom. Scrolling back up. Now, when we are looking at the spinal cord, you're going to find a slight enlargement at the inferior end of the cervical region. So about C6, C7, it's going to enlarge itself just a little bit. It's called the cervical enlargement. And then you're going to find that it actually enlarges again down by the lumbosacral region. And what is that enlargement? You're not gaining more nerves. They're just, instead of being a tight little cord, they're spreading out a little bit. So they've got a little bit of breathing room. Not a lot, just a little bit. Below the lumbar enlargement, the cord is actually going to taper into what we call a medullary cone, and then it's going to become a bundle of nerve roots from about L2 down to S5, and this bundle looks similar to a horse's tail. Very fibrous, very thread-like, and it's actually why it's named the cauda equina. Due to this spreading out that occurs due to this bundle of this horse's tail, this is why we do a lumbar puncture at about L2, L3. We have the most room in the spinal cord here, so we're less likely to accidentally hit a nerve with our needle. That being said, it's not a whole lot of space, so the risk is still high, and this is why lumbar punctures aren't done just willy-nilly. They are done after all due careful consideration because there is a high risk of damage. It's also why if you're getting a lumbar puncture done, they tell you, don't move. And inevitably, that's when you want to sneeze. But that is why. They want, if you move, they might accidentally hit a nerve because there's not a lot of space there. Here's our image again. Right, so gray matter. Gray matter, remember, is going to be the axons that do not have a myelin sheath. So down the middle or core of the spinal cord, we're going to have a bunch of gray matter, and it's going to have an H-like appearance on cross-section. We actually saw that in lab and also actually on the first day of lab. That H is going to be composed of 2 dorsal horns on the posterolateral surfaces and 2 wider ventral horns on the anterolateral surfaces. They're going to be connected right to left by something called a gray commissure. And near where the spinal root attaches, it's going to split into a posterior and anterior root. The posterior root of the spinal nerve is going to carry sensory information and is actually entering the posterior horn. I have a picture of this. And the anterior root is actually going to carry motor neuron information and be exiting the anterior horn. So the posterior root is coming into the spinal cord. The anterior root is coming out of the spinal cord. Spinal nerves carry both incoming and outgoing information. Now, surrounding these horns, we do have white matter. Remember, white matter is axons with the myelin sheath, and they're divided into columns. They're paired columns, anterior, posterior, and lateral columns. Within these columns, we have further subdivided them into tracts. Ascending tracts are always going to carry sensory information up towards the brain. Descending tracts are always going to carry motor impulses down from the brain. And this is what they look like. So here's our dorsal columns, here's our lateral columns, ventral aspect, here's our H of gray matter. Now, do you need to memorize for me that this is the lateral spinothalamic tract or this is the spinal tectal tract? No, just be aware that they are a thing. All right, and that's going to wrap up our conversation on the brain. We will be talking about, that wraps up our conversation on the spinal cord. We're going to talk about the brain next.